Baclofen Pump Introduction. Can you point to the nerves? Choose one of the following options. Correct. Baclofen pump placement can always relieve spasticity. Select true or false. Correct. Your doctor can help you decide if Baclofen pump placement can help you. Are heart attacks and other anesthesia-related complications common during and after Baclofen pump operations? Select yes or no. Correct. Anesthesia is now very safe. However, the older you are and the more medical problems you have, the higher the risks. You should make your anesthesiologist aware of any medical problems you have had in the past, such as heart attacks and lung problems. Are infections very common after Baclofen pump surgery? Select yes or no. Correct. Infections are very rare. Though rare, infections, bleeding, and scarring may happen. Infections and new neurological problems are common after this surgery. Select true or false. Correct. Infections and new instances of paralysis are very rare after this surgery. Although rare, these complications can still happen. The pump or other parts of the system may fail and have to be replaced. Select true or false. Correct. It is unlikely, but not impossible, for parts of the system to get out of place or not work and require a second operation. A patient may use as much Baclofen as he or she wishes once the pump is installed. Select true or false. Correct. Patients should use as little Baclofen as they can. As the dose of Baclofen is increased, it may stop being effective. It is important to use the lowest possible amount of Baclofen because Baclofen is expensive. Select true or false. Correct. A patient should use as little Baclofen as will control the spasticity, because when more Baclofen is given, it may stop being effective in controlling the spasticity.
Thank you for using Explain.